Well, Dr. Jennifer Wild joins me now from Oxford in the UK. She is an associate professor in experimental psychology and consultant clinical psychologist at Oxford University. Thanks so much for speaking to us. We have seen the video of those boys smiling, the notes they wrote to their parents and teachers joking about, their homework. Is that, though, just the initial elation of being found and, before someone actually lost his life trying to rescue them, or can that spirit actually be maintained?
It's difficult to know without actually assessing them, but we do know they have been relatively calm whilst in the cave. The coach was guiding them with various coping strategies and tools. We heard that they did some meditation, which would help to keep them calm. And we know that they have something to focus on. So once they were found, really focusing on the steps to get out will keep their spirits high and will help to protect them in the long term. And provided they can keep focusing on the facts of what happened, that they had an incredibly horrendous ordeal in a cave, that they were found, and most of them have now been rescued. And if they can keep focusing on those facts, then they will very much have a good prognosis. The other issue that can, of course, happen is that when they're out, they can be reminded of what's happened, and they may have reminders if they're in a similar situation, such as a room with a closed door, an elevator, somewhere the dark might be a trigger for them. Something dark might really trigger the feeling of being trapped in a cave. And if they can really focus on what's different today, that it's a room, it's not a cave, that it's a dark area, it's nighttime, they can switch on a light to give them light, that they're not trapped. Focusing on the differences today compared to what they experienced in the cave will very much protect them from going on to develop further problems. It is also normal in the first few weeks after trauma such as this to have unwanted memories and feelings from the trauma. These usually disappear within a few weeks as people adjust to what they've been through. So we would expect a good prognosis. Obviously, after a month, if they're continuing to have anxiety or lots of flashbacks or a lot of distress about what happened, then we would want to intervene with a trauma-focused psychological therapy, such as cognitive behavioral therapy.
Okay, tell us, though, what these boys have actually been through in the last 2 weeks. Starting from the moment when those floodwaters started pouring into that cave and they realized that they were trapped.
So I can only speculate, and what I would imagine is how terrifying that situation would be. So before they were found, they most likely would have had thoughts that they were going to die and never see their family again. It would have been absolutely terrifying. There would have also been potentially elements of hope if their coach was able to speak to them about the possibility of being found. And of course, they were found. So when they were found, that changes everything. It changes what they think about, and it changes their emotional state. Okay. And then it all becomes about the rescue and no longer what could have happened, but what actually is happening, which is that they're being rescued.
Okay.
And that is one of the main factors that will give them a good prognosis.
Okay. Unfortunately, Dr. Wild, we're going to have to leave it there. Thanks so much for joining us.